Collecting colostrum involves collecting the first nutrient-rich milk that comes from your breasts. This practice can be beneficial for both you and baby, especially if there's concerns about feeding after birth. So what is colostrum? Colostrum is a thick yellowish fluid that is produced by your breasts in late pregnancy and your first couple of days postpartum. It is filled with so many antibodies, proteins, everything your baby needs for those early days to develop their immune system and support their early development. So what are the benefits? Collecting colostrum supports early nutrition. Colostrum can be used if after birth your baby is struggling with feeding initially. So this could be if you want to breastfeed, this could even be if you want to formula feed and you want to give your baby a little bit of colostrum to start with. Colostrum also helps stabilise blood sugar levels. This is incredibly important if you have things like gestational diabetes. Giving colostrum can also help your baby in those first couple of days with immunity protection. This is because it's full of antibodies and proteins, like we said, that help with the immunity of that baby, which just helps support that baby in the first couple of days. So when should you start collecting colostrum? You can start around 36 weeks of pregnancy, but before you begin, have a conversation with your midwife and just make sure that collecting colostrum is appropriate for you. This starting time generally allows for you to build a small supply, ready for when your baby's born. So how do you collect colostrum? Preparing for colostrum collection. Wash your hands thoroughly before starting. Use sterile syringes or containers for collection. You can ask your midwife for these. Find a comfortable position, somewhere calm where you feel relaxed. Stress can make it harder to express colostrum. To help encourage milk flow, you could take a warm bath or shower, apply a warm compress to your breast, or use gentle massage techniques like nipple stimulation, which I'll explain now. Start with a gentle breast massage, using your hand in a fist shape. Work your way around the breast in a clockwise motion, applying light pressure. This helps with the release of oxytocin, the hormone that's needed for milk production. You can also use nipple stimulation by using your thumb and finger to gently stimulate the nipple. This encourages the release of prolactin, the second hormone needed for milk production. Shape your hand into a C with your thumb and fingers placed just behind the areola. Press gently and work your way backwards towards your chest, then compress and release in a slow, steady rhythm. If colostrum doesn't appear at first, adjust your finger placement slightly forwards or backwards until you feel the right spot. Do not rub or slide your fingers up and down the breast, as this can cause more pain and damage to the breast tissue. Once droplets appear, catch them in a sterile container or syringe. As the flow slows, rotate your hand to different sections of the breast and repeat. Once finished on one side, you can switch to the other breast to ensure even stimulation. You can express colostrum 2 to 3 times a day for about 5 to 10 minutes per session. Make sure to label each syringe with your name, hospital number, and the date of expression. Store in the fridge for up to 24 hours, but for longer storage, make sure to freeze immediately, and that can be then kept in the freezer for up to 6 months. Here are some things to think about with collecting colostrum. Try and avoid using a breast pump during pregnancy. Hand expression is advised. You can express colostrum up to 2 to 3 times a day. But if you experience any discomfort or contractions, please stop and contact your midwife. Collecting colostrum is a personal choice. It has many benefits, but if it's something you feel uncomfortable doing or just simply don't want to do, that is completely okay. It's also completely normal if you try to collect colostrum and you got very little or nothing at all. Everybody is different, and it really doesn't reflect on your body's ability to produce milk once your baby arrives. And if you got a little bit, it's still beneficial for your baby. So don't feel discouraged. So you might be thinking, I now have the colostrum, but what do I do with it? How do I take it to hospital? Here's some tips. You've stored your colostrum in sterile, pre-labeled syringes, and they're probably in the freezer. On the day you go to hospital, you're going to take the syringes out of the freezer and place them in a small cooler bag with some ice packs to keep it all frozen during the journey. When you arrive at hospital, let the midwife know that you've brought colostrum, and they'll take that bag from you, or just the syringes, and place it in the freezer on the ward. They'll then be able to give you the colostrum when you need it. This is why it's so important to make sure everything's labelled correctly with your name to make sure that you get the colostrum to you.